So now we are going to see this chapter 23, nursing care of newborn with special needs. So these include newborns who require additional care after birth, like SGA, small for gestational age, LGA, large for gestational age, preterm and postterm infants, as nurses early recognition and intervention are critical. So first we will see about factors affecting fetal growth. Fetal growth depends on maternal factors like maternal nutrition, maternal diseases, or if they have any disease problems, substance use, mother having alcoholism or substance abuse, genetics, genetics of the parents, mother and father. If there is any problems already genetically inherited problems in the family, child can get that. Placental function here, because placenta is the one supplying oxygen and nutrients to the baby from mother. Any problem with that placenta function can also affect fetal growth. Then environmental factors like any exposure to radiation, exposure to poison, exposure to smoke, all those can also affect the baby. Fetal factors, so genetics, infection to the baby, those are fetal factors. Any disruption can lead to growth abnormalities like SGA, that is small for gestational age, and large for gestational age. So birth weight variations here. So number one is appropriate for gestational age, AGA. That means the baby is appropriate for the week of pregnancy. Approximately 80% of the newborns normal height, weight, head circumference, body mass index. So that means they are suitable for the, or they are appropriate for the week of their gestation. If they are 38 weeks, their growth is appropriate for 38 weeks. Small for gestational age, we call it SGA. So here weight is less than 2500 gram. That is in LB it is 5 LB, ounces it is 8 ounce. At term or below the 10th percentage. By the time the baby born at term, so baby weight will be less than 2500 gram, 2.5 kilogram. So large for gestational age, weight is 90th percentage on a growth chart. So weight is more than 4000 gram at term. So if the baby is more than 4 kilo, so that is baby is large for gestational age. So birth weight variations, here we talk about low birth weight, we call it LBW, infant weighing less than 2500 gram or 5.5 kg, sorry, LB. Very low birth weight, VLBW, means infant weighing less than 1500 gram or 3 lbs or 5 ounce. Extremely low birth weight means ELBW, infant weighing less than 1000 gram or 2 lb or 3 ounce. So always interpret birth weight with the gestational age. For example, 2.5 kg baby may be normal at 37 weeks but small for 40 weeks. So always make sure we interpret the birth weight with the gestational age. Growth charts are essential tools here. So now we talk about small for gestational age newborns. So we'll see what are the characteristics of a preterm newborn. So most of the preterm newborns are small for gestational age. SGA infants are smaller than expected due to IUGR, intrauterine growth retardation. Causes often include placental insufficiency or maternal illness. So maybe mother has some illness and unable to take enough nutrition, or that is affecting the mother's intake. So, or whichever is affecting the placental insufficiency, because the child is getting nutrition and oxygen through the placenta, right? So if there is any problem with the placenta, any problem with the circulation of placenta, so that can affect the size of the baby, because baby is not getting enough nutrition and oxygen to grow well according to the uh, gestational age. So here characteristics of a small preterm infants include few plantar creases. See, when you see the plantar creases, you can see very few plantar creases. Soft pliable cartilage. So especially ear is made of cartilage. You can see this is more like fused, and then so very soft cartilage. Matted hair looks like matted in appearance, and fused eyelids may be fused like that, not open yet. Lax posture with poor muscle tone, so their activity will be less because their body is very relaxed. They don't have enough muscles to have a, like enough contractions, or enough muscle movement. Breast and nipple area barely visible. Nipple is only developing, it's not dark or thick like in term babies, so it's going to be, you can barely notice the breast tissue there. Male genitalia with minimal rugae on the scrotum. So the rugae means the what do you call, the shrinking appearance of the scrotum. So that is normal for a term baby, but when it comes to a small for gestational age or a preterm baby, the rugae, that shrinking of the scrotum is less. Scrotum looks more smoother in appearance. But if it is a female genitalia with a prominent labia and clitoris, so you can see prominent labia and clitoris because their body is developing into it. So that may be more than the size of the body. Small for gestational age newborns, conditions affecting fetal growth here. So if they're less than 28 weeks, leading to overall growth restriction, never catch up in size. If they're more than 28 weeks, intrauterine malnutrition, normal growth potential with optimal postnatal nutrition. That means if they're below 28 weeks, leading to overall growth restriction. It's very hard for them to catch up. But if they're more than 28 weeks, so that's happening, they're small because of the intrauterine malnutrition. Once they're born, so normal growth is potentially up, they have the potential to grow normally with the optimal postnatal nutrition, if possible. IUGR for some SGA newborns. So some small for gestational age babies have a intrauterine growth retardation. Asymmetric versus symmetric. So we call it asymmetric versus symmetric, means in symmetric IUGR all parts of the baby's body are proportionally small, while in asymmetric IUGR the head and brain may be normal size but the rest of the body smaller than expected. So from the name itself we know asymmetric means they're not symmetrical. Their head and their brain looks bigger than the rest of the body, so they're not proportionate. And then symmetric, here all parts of the body they're proportionally small, but they are symmetric, but they are appropriate portions. And contributing factors here as we talked before, are maternal factors, placental, and fetal factors. So, small for gestational newborn assessment, typical characteristics of small for gestational age newborns: head disproportionately large compared to the rest of the body. Their head is large compared to the body. So, and then wasted appearance of extremities, loose, dry skin. So that means they don't have enough muscles, or they don't have enough subcutaneous fat. So they look like wasted appearance, muscle wasted appearance. Reduced subcutaneous fat stores, as I said before. Decreased amount of breast tissue. So as we said, the breast tissue is decreased, and then nipple and areola is barely visible. Scaphoid abdomen, sunken in appearance. Scaphoid means opposite to dilate, so distended. So sunken in appearance, and then wide skull sutures. You can see the sutures in the skull, between the skull bones are wide. Poor muscle tone over buttocks and cheeks. So, usually buttocks and cheeks, they have good muscle, but usually in small for gestational age, the muscle formation is not happen very well in the buttocks and cheeks area. Thin umbilical cord. Their umbilical cord may be very thin. So sometimes a thin umbilical cord may be one reason for small for gestational age, because that umbilical cord, the veins in that is not efficient enough to support the needs of the baby. So you can find these babies having loose, dry skin, thin body, large head compared to body, and then sometimes this reflects in chronic poor nutrition in utero. So all these happen mostly because when the baby was in the uterus, he was not getting enough nutrition. So we'll see some of the common problems small for gestational age newborns has. So perinatal asphyxia. So this means hypoxia prior to birth. So no oxygen reserves to tolerate stress of the labor. So perinatal asphyxia means during the time of delivery, like the process, during the process of delivery. Perinatal, during the process of delivery, baby can have asphyxia, no oxygen, because they don't have any oxygen reserves to tolerate the stress of labor. What is the stress of labor? That is, the baby is going through the contraction for a long time, mother's contraction. So this can result in hypoxia prior the baby is born. Difficulty in thermoregulation, because they have less subcutaneous fat. So subcutaneous fat act like a blanket, right? So because they have less subcutaneous fat, so that can result in thermoregulation. They feel cold all the time. And hypoglycemia. So here, gestational diabetes mellitus mothers, this happens to kids, those mothers with GDM. Abrupt cessation of high glucose event. So sometimes you can see like it's happened suddenly. Glucose levels go down. So then polycythemia. So here chronic hypoxia, because the baby had, here we say baby had asphyxia and then maybe chronic hypoxia before birth. So that leads to more erythropoietin production because of the hypoxemia. So if you learning the pathophysiology of polycythemia, if the patient is on hypoxemia for a long time, so the erythropoietin amounts will increase, that increase in increased RBC production. What is polycythemia means? Polycythemia means increased RBC, high HB, right? More HB in their body. So yeah, that's how it is happening. The chronic hypoxia triggers increased RBC production that cause increased hemoglobin in the body. Meconium aspiration. So Meconium aspiration can be happen, as we said, that's a very common problem for the babies there. So during the why their meconium aspiration, as we said, we are already saying the patient is in asphyxia, in fetal distress here. When the baby having fetal distress here, distress in the baby's, in the mother's womb, what they will do, they pass meconium. So when they pass meconium, that stains the meconium. Remember we talked about before, baby is sucking the meconium in, so that can sometimes with their light chest movement, they have a movement that they're not breathing, but some chest movements are there that can bring the stained meconium stained fluid into the lungs, and they can cause aspiration. Hyperbilirubinemia, so polycythemia and RBC breakdown, inability to tolerate feed, and increased erythropoietic circulation of the bilirubin. Hyperbilirubinemia can happen here. So as because of this, polycythemia is already there, and RBC breakdown, inability to tolerate feed, so they cannot tolerate feed here. So like when they have hyperbilirubinemia, what they have, kind of jaundice, right? So most people, when they have jaundice, they have nausea. Why they have nausea? Because that affects their liver, right? When you have something in the liver, you feel like you are nauseated, cannot eat anything properly. So increase erythropoietic circulation in the bilirubin. Birth trauma, so can be also birth trauma, like we said. If the baby can have a birth trauma from like if they're using a vacuum suction or something, like that can cause birth trauma. Or if they're using any kind of metals to take the baby out, so that can cause birth trauma to the mother, the baby's head, from the forceps and the vacuum they use to deliver the baby. So nursing management here. What nursing management we do here for small for gestational age newborns? So we need to maintain their weight, length, and head circumference, like according to the unit policy, maybe every day or every other day, whatever the hospital or unit policy is. Serial blood glucose monitoring, want to make sure the baby is not going for hypoglycemia, so we need to treat it immediately, right? And then vital signs monitoring. Why vital monitoring is important? Because baby can have a hypoglycemia, hypotension, so that can want to make sure baby is not getting any infection, and also baby is keep them quiet. Early and frequent oral feedings, IV infusion of dextrose 10%, monitoring for signs and symptoms of polycythemia, anticipatory guidance. So what are the symptoms of polycythemia? So as we said before, polycythemia is the increased hemoglobin in the body. So in newborns, when they have a polycythemia, they look ruddy in color, like a plethoric, deep reddish purple skin, because of the increased amount of RBC in their body. Cyanosis, blue discoloration, especially around the lips. You can see cyanosis around the lips. So neurologically, they have lethargy, very sleepy, irritability, poor feeding, hypotonia, decreased muscle tone, and seizures. Respiratory, tachypnic, they have very rapid breathing, respiratory distress, and apnea disorders. Cardiovascular, so tachycardia, poor perfusion. So in a gastrointestinal, poor feeding, vomiting, abdominal distension. So these are the symptoms we can see in a child with polycythemia. So anticipatory guidance, educate parents about follow up and what to do, what to anticipate after they discharge from the hospital. So that's what anticipatory guidance means. Risk factors associated with the large for gestational age newborns. So, birthing parent, main risk factors are maternal factors, maternal diabetes, that's the most important thing, and then maternal obesity and postpartum pregnancy. Excessive gestational weight gain also can cause to large for large babies. Infant factors include having a sibling who was LGA and has certain genetic symptoms. Some, if you see some families, all the people in the families born as big children, large children. That is genetic thing going on in the family. So, same vice versa too. Small for gestational age. Some families, all the children born in that family are small in size. And then large for gestational newborns, assessment and common characteristics. So they are large body and then they're large in size, plump, that means they look very full and full faced. So they have more subcutaneous tissue, more muscle available. Proportion increases in body size. So the in proportional increase in body size. So body size is more than the uh, normal children. Poor motor skills, so they have poor motor skills, so that can affect in their reflexes. Difficulty for regulating behavioral states. So sometimes it can be because of mothers in the substance abuse or something like that, that can affect the child also when they're born. Common problems with the large for age newborns, birth trauma. So that's because sometimes they can be shoulder dystocia, so that can cause injury to the shoulder bone, right? So or sometimes it can cause plexus injury, brachial plexus injury when they are trying to take out the baby through hand, like with the hand presentation, shoulder presentation, like that. So baby can be hypoglycemic and then insulin dependent over dependent solution at this time, and then polycythemia, as you said before, they have a lot of hemoglobin is produced in the body. Hyperbilirubinemia, like they have a jaundice here. So largely for gestational newborns, new nursing management. So we need to check their vital signs, blood glucose monitoring, initiation of oral feeding via IV, glucose supplementation as needed, continuation of in monitoring of signs and symptoms of polycythemia and hypoglycemia. So we already talked about the symptoms of polycythemia. So what are the symptoms you will look for hypoglycemia in patients with small babies with hypoglycemia? What symptoms we will look for? So here we mainly look for children having jitteriness. Sometimes they have a big cry. Sometimes they're sweaty. So seizures all can happen in hypoglycemia. So hydration, make sure the baby is feeding well, getting enough, not just breast milk, and water too, clean water. Phototherapy for increased bilirubin level. So as you said before, if the bilirubin levels are higher, like in jaundice, and then so they have to get phototherapy to reduce the amount of bilirubin. Gestational age variation. So term means born from the first day of the 30th week through 48 weeks. That means babies born between 38th week and 42 weeks called term babies. Preterm means born before completion of 37 weeks, they are preterm. So low term means children born between 34 and 36 weeks. So post-term means born beyond 42 completed weeks, beyond 42 weeks. So post-term newborn. So here we look at the characteristics of post-term newborn. Inability of placenta to provide adequate oxygen and nutrients to fetus after 42 weeks. And now after 42 weeks the baby is getting bigger, and then now placenta cannot supply all the nutrients needed. So nursing assessment here, typical characteristics: dark, uh, dry, cracked, wrinkled skin, possible meconium stained. So like I said in the class, they have a old man look. Long, thin nails, long nails, creases over the entire sole of the feet. So they can have the entire sole of the feet have a lot of creases there, and then nails are long enough because after 42 weeks everything going to grow very fast. Abundant hair on the scalp. They have more hair on their scalp compared to a normal term baby. So thin umbilical cord, sometimes the umbilical cord can be very thin, not enough to supply for the average health of the baby. So what are the nursing management here for post-term newborns? So resuscitation is needed if the baby have any breathing problems. If the baby doesn't have any breathing problem, you don't need to do that. So baby is not cry, like maybe because of hypoglycemia or any of the problems with the mother. So alcohol withdrawal symptom, baby have any problem with the breathing pattern, then we have to do the resuscitation there. Blood level glucose monitoring, and then initiation of feedings. So IV dextrose 10 percentage maybe need to start for feeding, and then prevention of heart heat loss. So that's why we need to keep the baby swaddled. Evaluation of polycythemia. So mostly postterm and preterm baby they can have a polycythemia. So look for polycythemia. Then parental support. Parental support is necessary here. Etiology leading to preterm birth. So the etiology, the causes of preterm birth maybe, as you said before, can include infection, lot of infection to the mother or the baby, and then maternal or fetal distress is there, leading to preterm birth. And then bleeding, like what are the bleeding causes, like placenta abruptia and placenta previa. Stretching, overstretching, what are the reasons baby the mother's abdomen can be stretched. Remember we talk about this in the class, that is overstretching may be due to twin babies or due to polyhydramnios. So these are the etiology leading to preterm birth. So preterm newborn. Body system immaturity affecting its transition into extrauterine life, increase risk for complications. So when they are preterm, so their body systems are immature enough to survive outside the uterus, that is on the extrauterine life. So this increases risk of complications. As we said, the main problem is there because the lung is not matured enough. So respiratory system is the main, and then cardiovascular system, gastrointestinal system, renal system, immune system, central nervous system. So all these systems may be not matured enough to for the baby to make the survival easily possible. So common characteristics of preterm babies: they weigh less than 5.5 lbs, scrawny appearance, they look like very small, poor muscle tone, the muscle tones are very less, minimal substance abuse, minimal subcutaneous fat. So they have a very minimal subcutaneous fat there. So that's the reason they feel cold also. They can be very easily hypothermic. So that's the reason we are covering them with a swaddling or a blanket. Then undescended testes, as you said before. So most of the preterm babies, the scrotum looks empty. So where is this testis? This testis may be somewhere in the abdomen. So usually when the baby turns term, the testis is descended into the scrotum automatically, but here it's maybe early for the process, so you'll see the descended testis looks very smooth. And then plentiful lanugo, so they have a lot of hair on their uh, body. Poorly formed ear pinning, so you can see the ear is fused together, the pinna is fused together with the head, so it takes time for that to separate from there. Fused eyelids, you can see the eyelid of the preterm baby is fused together. They cannot they cannot open the uh, eyes like in a newborn baby. If you see a newborn baby, if they are awake, you can see them, they are looking at you with widely closed eyes. Preterm newborn assessment here. um, Other common characteristics. So common problem with the preterm newborn infants are hypothermia. As we said, they don't have enough insulation, fat and subcutaneous tissue. So that can cause hypothermia. Hypoglycemia, especially for mother who have a diabetes, gestational diabetes mellitus. Child also can be um, um, so here. And then hyperbilirubinemia. So here the bilirubin levels are higher, so that means maybe the baby have um, physiological jaundice or pathological jaundice. Problems related to immaturity of body systems. So as we said before, most of the systems are immature, so for example, a main organ is the lung, because the lung is immature, they have problem uh, with the breathing, right? So they'll be there. So their skin is immature, skin is very fragile. So because of they have problem with thermoregulation, right? And then their genital system is not matured. So because of that, you can see undescended testes, right? So the gastrointestinal system is not well matured. So because of that, you can see they may not be able to tolerate feedings, their neuromuscular system is not well developed. Because of that, you will see their all the reflexes are weak. Even the sucking reflexes can be weak, if the sucking reflexes is weak, and then it's very hard to feed the baby. So nursing management for preterm newborns include oxygenation, give them oxygen as needed, because of their lungs, oxygen is the main problem. And again, making sure that don't apply too much oxygen, so that can cause ophthalmoneonatropy, right? So the retinopathy in babies, so that can cause blindness, retinal detachment and blindness, like we said in the last chapter. If you listen to the last chapter, you can see the stages of how we learn about the stages of retinopathy, so that the high levels of oxygen can cause retinopathy. Thermoregulation, we already talked about that many times. Nutrition and fluid balances, because they don't have enough, their stomach is not developed also, so that they have problem with the nutrition. So we want to make sure their nutrition is met through some other methods, maybe nasogastric feeding, IV fluid, or IV glucose. Then infection prevention, because they're small and then now they have less immunity, so they're very prone to infection, so we need to keep them in a very clean way. Stimulation, sometimes they need some stimulation. They may be their muscular systems are not developed properly, they maybe need stimulation for moving their their arms, and also maybe need stimulation for sucking reflexes, because sometimes their sucking reflex may be weak. Pain management, if the child is in pain, then pain need to be managed, depends upon the child's condition. provide developmental care. So give care according to the week or according to the age of the baby. So newborn babies, as they grow, so they need care for every every developmental stage, because their development may be delayed compared to a normal born baby. So don't expect a preterm born child to do the milestone developments same as of a term developed baby. They may be always behind in all the activities, like talking, walking can be behind compared to the same age group. Parental support, high risk status, possible perinatal loss. So sometimes, it's very high risk for them. Sometimes preterm babies, they're very small, so it's very hard to survive. That can cause perinatal loss. To discharge preparation, if the child is ready for discharge, if the doctor is saying, oh, now they can go home, they can be discharged, so then we have to make sure what education we can given we can be given to the patient, because they do things at home based on how we teach them. So critical components of discharge planning here. So this is in your book chapter 23 box 4, saying parental education involved and support in newborn care during NICU stay, while ensure the readiness to care for the infant at home, evaluation or unresolved medical problems, then implementation of primary care, development of home care plan, including assessment of equipment and supplies needed for care. So in-home caregivers preparation and the ability to care for the infant, adequacy of the physical facilities in the home, an emergency care and transport plan if needed, if the baby is sick or mother is sick, if there is breathing difficulty in the baby, something like that. And then financial resources for home care costs, family needs and coping skills, common community resources, including how they can access the benefits, because that way they can take care of the baby properly if they have enough financial resources. So that, and then dealing with perinatal loss, when the family dealing with perinatal loss, what we do. So perinatal loss means when that baby is, like died. So what we do. So any average pregnancy loss or neonatal death up to 1 month of age. So that is, like that's normal to have, that is expected at the 1 month of age. Preterm babies or, like small babies may die, and then a profound experience to the family. So for family, whether it is a 1 year old or 3 month old or 1 month old, so that is the part of the family, so that it can be very profound experience, very hard time for the family. Avoidance is a common reaction. So sometimes the parents try to avoid people, avoid others, but as a nurse you need to understand that that is a common reaction people show when they have a perinatal loss. Nurses must be aware of personal feelings, and then so that you can communicate with the empathy to the family. So always make sure if you are in their shoes, what you will do, so and treat them like that. Okay, so that's about this chapter.